Good morning. And welcome to Johns Hopkins in Cape Town. It's so nice to be able to welcome you to your own party. Well, this is our beautiful mother city, our glorious and dichotomous city, which on the one hand draws international medical tourists to undergo elective surgeries attracted by the relatively affordable rates, and on the other hand, our city buries children who die of treatable diseases. Our streets are stalked by a silent epidemic of malnutrition, and vast tracts of our communities are plagued by the ills that accompany poor sanitation. Welcome to our first world, third world city. The World Health Organization's constitution enshrines the highest attainable standard of health as a fundamental right of every human being. And the South African Constitution concurs. But the rights enshrined in the documents of our highest ideals are not exactly the rights experienced by the man or the woman, and very often the woman, on the street. In our Constitution, we're entitled to the best in our world, access to resources. But access to resources is skewed, and ingrained prejudices tilt care away from those most in need towards those better able to pay. The highest attainable standard of health care depends very much on where you live and how much money you have stashed away. There is, however, a growing consciousness that this inequity is not sustainable. The old ways of thinking and accumulating wealth and hammering our environment at the expense of each other are rapidly running out of road. Denying people health treatment on the basis of their social circumstances, geographic location, gender identity, or sexual orientation is immoral. We are recognizing that it is fundamentally unfair and inexcusable that the most marginalized groups of people should bear the highest health costs. And we recognize that in a global village that we inhabit today, none can afford to turn a blind eye to what may have been regional health crises in the past. Bird flu, Ebola, and now Zika attest to that. To Johns Hopkins University and the Johns Hopkins Bloomberg School of Public Health, thank you for your vision and foresight in establishing the Desmond M. Tutu Professorship in Public Health and Human Rights. A special thanks to Ed and Kathy Ludwig, the donors, the principal donors who have made this chair possible. To the Richards family, to the president of the university, Ron Daniels, and to Dean Mike Klag. And thank you to the JHU team for pulling together this lovely event. And a very special thanks across the ocean to Michelle Bohanna, dear friend of the Arch and dear friend of Chris, who have brought the two together with this passion for human rights and the passion for public health. We all desire a world in which all can flourish, and we can only truly flourish if each and all of us can flourish. So thank you for honoring the Arch in this wonderful and oh so appropriate way. And congratulations on a visionary initiative. And God bless you.
Thank you, Mpho. I remember the last time we met was in Baltimore in my office, and you know Baltimore well. And many of the comments that you made about Cape Town apply equally to Baltimore in the U.S. And so the magnitude of problems may be different, but we're struggling with the very same issues. And I've never heard your father referred to as the Arch before, but I think that fits. And the last time I saw him was also at Hopkins around 1986 when you spoke at the Martin Luther King Day. And he impressed everybody with his humor and his humanity. And it was a wonderful day for Hopkins. It's great to be here with everybody in Cape Town. As Dean of the school, it's really a great honor and pleasure to participate in this dedication today in the installation of Chris Beyrer as the inaugural Archbishop Desmond Tutu Professorship in Public Health and Human Rights. Our school and our entire institution is incredibly proud and honored to have the name of Desmond Tutu associated with our school for perpetuity. The dedication of an endowed professorship is a particularly wonderful moment in the life of an institution. And when we do these ceremonies at Hopkins, we usually go through the history of the endowed professorship, starting with Oxford and Cambridge. But I'm going to spare everybody that today. But it serves several functions. It recognizes the generosity of donors who want to contribute to the life of an institution, as well as the accomplishments of our individual faculty. Private philanthropy is what makes these opportunities possible. And as you said, we're very, very grateful to Kathy and Ed Ludwig for their generosity, as well as the other donors that you mentioned. This professorship also honors the tireless work of Archbishop Desmond Tutu. And I'd like to take a moment to thank, as I did before, Kathy and Ed, but to acknowledge that we've come a long way for this. And Kathy sits on our Health Advisory Board and chairs the board of the Center for Public Health and Human Rights. Ed was a longtime member and chair of our advisory board. So we had a meeting in Barcelona before this and came here. So we've been away from home for a long time, and we appreciate it. We also appreciate your sons, Mike and Kevin, joining us, and Mike's wife, Julie, and Kevin's friend, Carrie. And also want to recognize Chris's sister, Kate, who traveled from San Francisco to be here. So thank you. And then we have a few. So once you start this chain, it's hard to stop. Okay. But you know, Patrick Sullivan, it's good to hear from him. It's Dick Chason and others. But today we're honoring Chris. And as many of you know, Chris is a professor in the departments of epidemiology, international health, and health behavior and society at our school. He's also the founding director of the Center for Public Health and Human Rights. He established it in April 2004 to advance fundamental human rights through research, teaching, and advocacy. And at that time, it was the only such center in the School of Public Health. It recognized the need for a population-based approach to prevent and minimize the consequences of violations to human dignity, to assure the fundamental right to health and well-being for all persons around the world are maintained. As some of you know, in 2012, Chris got a second job and became the president-elect of the International AIDS Society, which is the world's largest association of HIV professionals. The society has members from more than 180 countries working on all fronts of the global AIDS response. Currently serving as president, Chris and his team are in the throes of preparing for the 21st International AIDS Conference to be held this July in Durban, South Africa. Congratulations to you, Chris, and the entire team for reaching this milestone, and I know you'll be even happier when it's over. So that's it. So we could talk all day about Chris's accomplishments. He's tireless. I mean, the amount of work he gets done and what he's done to make the world a better place really has been incredible. Suffice it to say that we honor him today for his tireless and passionate work in bringing the tools of public health research to provide the rights of health and human dignity to the world's most disadvantaged people. Please join me in congratulating Chris on this wonderful occasion. Of all the gifts that a university receives, few make a more profound or lasting difference than the gift of an endowed professorship. Appointment to an endowed chair has been a coveted honor for distinguished faculty. Not that he covets anything, I mean, it's, in the best possible sense he covets. For distinguished faculty ever since the first professorships were created 5 centuries ago. We're proud that the Johns Hopkins University now boasts more than 400 named professorships. The Desmond Tutu Professorship will be the 30th such endowed professorship at our school. And it's especially fitting, we think, that it's occurring during our 100th anniversary. This is our centennial year. And I cannot think of a better way to celebrate our centennial year than to install Chris as the professor. And I see Steph Barald must have just sneaked in the back, another member of Chris's team and faculty member. So, and what the endowed professorship does for our school, in addition to being an honor for the faculty member and providing much needed resources, it enables us to recruit and retain truly exceptional faculty leaders like Chris. So on behalf of the entire Johns Hopkins University, it's my privilege to accept the Desmond M. Tutu Professorship in Public Health and Human Rights. I extend my deepest thanks to Kathy, Ed, and 2 others who aren't with us today for making this day possible. Normally, accepting an endowed professorship on behalf of the university is done by the president of the university. Our president, Ron Daniels, is a passionate supporter advocate for marginalized populations and for human rights. And he is very upset that he just was not able to be here today. But he sent us a video with some greetings. So if we could watch the video, please.
Dr. Martin Luther King Jr. once spoke to a group of young people near the Johns Hopkins campus in Baltimore. At a time of uncertainty and upheaval, he urged them to remember, we are caught in an inescapable network of mutuality. I can never be what I ought to be, he said, until you are what you ought to be. Today we honor this idea as we dedicate this professorship in the name of Desmond Tutu. And we do so with so many who have committed their lives to fostering a network of mutuality in a world where far too many people cannot yet be who they want and ought to be. Archbishop Tutu has given voice to the voiceless, power to the disenfranchised, dignity to the marginalized, and in doing so, hope to us all. From the streets of South Africa's poorest townships to the halls of the United States Congress, he has argued fearlessly and persuasively that no person, no society can be healthy unless basic human rights of freedom and equality under the law are afforded to all individuals. He has shown that peaceful advocacy can change the trajectory of individual lives and the lives of nations. And he has used his voice to inspire others to act. Certainly, one who has been inspired by and shared common cause with him is our inaugural Tutu professor, Dr. Chris Beyrer. From his work on the wards during the early days of the AIDS crisis in the United States to his present leadership role in staunching the disease's spread around the globe, from his efforts to illuminate the man-made causes of the health crisis in Zimbabwe, to his advocacy for prisoners and others living on the margins of society who require and have the right to effective health care, Chris has harnessed unassailable scientific evidence and unleashed powerful advocacy to ensure that our most vulnerable citizens receive the same respect, compassion, and care due to all persons. Joining with colleagues and friends to support this professorship, Kathy and Ed Ludwig have once again affirmed the values woven in the fabric of their lives, in the classroom and the boardroom, as supporters of artists who speak against human rights abuses, as trusted advisors and public health advocates dedicated to eradicating health disparities around the globe. Ed and Kathy, we are so grateful for your vision and your leadership. We are honored by your trust in Chris Beyrer and the Johns Hopkins Center for Public Health and Human Rights to strengthen this network of mutuality and realize a shared vision of a healthier, safer, more compassionate world. Chris, congratulations. We know that you will continue to carry forward in your work the great spirit of this professorship's namesake, your colleague, friend, and teacher, Desmond Tutu. And Archbishop Tutu, thank you for all that you have done to advocate, to inspire, and to cultivate a spirit of Ubuntu in so many.
And Ron, as I alluded to, is a staunch advocate for vulnerable populations. His background is he's a lawyer. We don't have a law school at Hopkins, but we have our president who's a lawyer, and he worked on issues of international human rights. So he's been a wonderful advocate for the work that our school and that Chris does. And now I'd like to welcome to the podium Kathy Ludwig. When I became dean 10 years ago, Kathy and Ed were two of the first people I met. And I could not think of a better introduction to the mission of our school. They're staunch advocates for social justice, for advancing the lives of marginalized people in the U.S., around the world, political prisoners. They do so many things, and they've been a great help to me personally and to the faculty and staff of our school. So please welcome Kathy Ludwig.
Good morning, and thank you all for being here. This is a wonderful occasion. Well, this has been a long journey to get to this point today, celebrating the installation of the Desmond Tutu Professorship at Johns Hopkins Bloomberg School of Public Health and the Center for Public Health and Human Rights. Believe it or not, it started in Thailand in 2000. It was the first trip for my husband and me with the Health Advisory Board of the school. Ed was the chair at the time. That trip was not only my first experience with the incredible people who support the school philanthropically, but it was an opportunity to spend time with faculty. And so that's how I met Dr. Chris Beyrer. And we cried. We cried because of the injustice of AIDS and the people who were being treated so unfairly. Their crime was that they had no money or power, but they or a member of their family had this deadly disease. They were ostracized from society and condemned to further poverty, disease, and death. I knew this was wrong. Chris and I had many conversations during that trip, and I came to know that he was a very special person, not just because of his amazing achievements as a doctor and a scientist, but because of his heart. Chris was not in this for himself. He was in it for everybody. Of course, HIV/AIDS is his focus, and he is dedicated to the communities most affected by this terrible disease. We traveled again in Africa a few years later, and Ed and I knew that Chris's work was going to be a part of our lives at that point. We were here in Cape Town, and Chris led the group out to Massapumalele so we could see firsthand the conditions under which people were living at that time. He brought not just hope, but solutions to the township. That was about 10 years ago, and today we are seeing the progress that is being made, although there is still much to be done. I have heard that nobody can say no to Chris, and that's true. So that's why I humbly accepted being the chair of the advisory committee at the Center for Public Health and Human Rights. But also, nobody can say no to the dean. Dean Klag is very persuasive. If he asks you to do something, it's important. So it was Mike who came to me and Ed and asked us if we would contribute to the professorship in support of Chris. We know how very supportive Mike is of his faculty, and we feel honored to help him in that support. Without Mike's leadership and vision for both the school and its supporters, we would not have had the opportunity to be here today. Finally, we want to thank Archbishop Desmond Tutu for giving his name to this professorship. Archbishop Tutu is a champion of human rights, speaking for those with no voice in society. His wisdom and leadership are examples to the world of the spirit of Ubuntu, basically kindness to others. His long friendship with Chris Beyrer and their united fight against HIV/AIDS are the foundation for a much improved future for people living with AIDS, and one day, a world without AIDS. Thank you.
So every 2 years or so, we try to take our board to places to see public health issues and public health action. And the first trip I took with the board was to go to come here to Cape Town and visit Massapumalele. It took me 3 months to learn how to say that. It almost ended my deanship. But we were exposed to the wonderful work of Linda Gale Becker and of Robin, and and I have to say, having not been there for 9 years, I know you must sometimes get up in the morning and think about the struggles, but the progress is just incredible. We were all so impressed yesterday, and I always say to our board that people who care about public health are good people. And the Ludwigs are living proof of that, and as are many of you in the room here. So thank you, Kathy, for those very kind words. And I think, Lucy, I know my wife feels the same way, that we could not have, as dean, you have to work with lots of different people, right? It comes with the job. And one of the great things about public health is the people I get to work with are great people. But you guys are the archetype. You're incredibly altruistic and selfless, but practical as well. And I really value all the advice and help that you've given me, and I know to Chris as well. So now it's my privilege to introduce the Archbishop. He really defies all introductions. If we were to spend time to review his historic accomplishments in the promotion of peace and justice around the world, as well as here in South Africa, we'd have to be here all day. And even then, we could only just scratch the surface. But maybe I can sum up just a few of his accomplishments and say that he is public health personified. I'm sure there's people all over the world who claim him for their field, but we claim him as the personification of public health. His life's work has been dedicated to improving the conditions by which all people, individuals, communities, countries, and beyond, can access their right to health and to human dignity. I can think of no greater calling or legacy. On our first day in Cape Town, we took a tour, so we were jet lagged, and we had a tour, and the tour bus driver was from Cape Town, the guide, and his name was Desmond. And we remarked that his name was Desmond. He said, "My mother named me after Desmond Tutu." And we said, "Why?" And she said, "You don't mess with Desmond Tutu." So it's my true privilege and honor to turn the program over to the Archbishop. We've asked him to say a few words and then to introduce Chris Beyrer as the inaugural Desmond M. Tutu Professor in Public Health and Human Rights at the Johns Hopkins Bloomberg School of Public Health. Archbishop Tutu.
It's wonderful to have my kind of complexion, because no one notices when you are blushing. God does have an amazing sense of humor, doesn't she? After a lifetime of struggle, standing up for others, I have reached a stage of life that simply standing up is a struggle, requiring great forethought, as you saw, and planning. To be honest, I'm not sure whether you're asking one as decrepit as I to address you would be more correctly described as an abuse of human rights or a public health issue. More than 70 years ago, tuberculosis came very close to taking my life. The loving care that I received made a deep impression on me, and although I had fallen behind with my studies, I resolved to become a doctor. I worked very hard to catch up, applied to medical school, and my application was accepted. But our family didn't have the resources to pay the steep fees, and they were unable to nail down a bursary. So I qualified as a teacher instead. Of course, I later gave up teaching to study theology and joined the ranks of the clergy. But that's another story. The point of this story is that although I have been blessed to lead a wonderfully fulfilling life, to travel widely meeting fantastic people, and even receiving a few honorary doctorates, there has always been a part of me that would have preferred to be a real medical doctor. You're establishing this professorship, combining my passions for human rights and healthcare, is therefore especially meaningful to me. You are, as it were, helping an old man assuage a childhood itch. Thank you for gifting Johns Hopkins with your generosity for establishing this chair. Thank you, Johns Hopkins, for thinking that it would be right to name it after me. Where Chris? Thank you for agreeing to be as the first incumbent of the chair. It is very humbling. Thank you very, very much. Thank you. Thank you for acknowledging the indelible links between human rights and public health. Thank you for recognizing the exceptionally capable and compassionate Chris Beyrer as the first bearer of this professorship. I'm so very proud to be associated with him. We are kept in touch by a minute little lady, Michelle Bohana, who lets us, especially, get to be involved in Myanmar and all of what has been happening there. And long before I met Chris in the flesh, I had already known, that he had a passion for justice and goodness and human rights. And it is a very great privilege to have been, and to be linked up with him in the manner in which this is going to do. Thank you, Dean, thank you, all of you for taking the trouble to travel all the way to Cape Town for this ceremony, to allow this old man to bask in your glory. I should be saying, welcome home to Africa, to all of you. Because many years ago, I shouldn't be telling you this because I know you are a lot smarter than I, and you know all the details of it. Before my time even, long ago, human life started here. In fact, my hometown is only a few kilometers away from where they say is the cradle of humankind. So our abilities to reason, to love, to be compassionate and caring started here. God does have an extraordinary sense of humor.
He does.
Yeah.
She does, okay.
There is an old African idiom that says wisdom is like a baobab tree. No one individual can embrace it. When enough of us link hands, hearts, and minds, when we realize that we are all ultimately members of one family, God's family, we make the undoable doable, the impossible possible, and become an irresistible force. In South Africa, after the dawn of our democracy, HIV and AIDS taught us very painful lessons about the links between human rights and public health. Poor South Africans were denied treatment for several critical years, leading to the unnecessary loss of hundreds of thousands of our people. Many of the mothers and fathers at the most productive stages of their lives. What was a public health crisis became a human rights crisis. And we thank God for the role of civil society that it played in eventually forcing our government to provide life-saving medicines. To the north of us in Zimbabwe, the collapse of the healthcare system with the economy 8 years ago led to our collaborating with Dr. Beyrer for the first time. The Darfur genocide in Sudan, the plight of political prisoners in Myanmar, the aftermath of the economic meltdown in Zimbabwe, and the homophobic policies and practices of various African countries have been some of the theaters in which we have since cemented our ties. Human rights is a universal measure. It was Martin Luther King, whose assassination we have been commemorating earlier this week, who said, "Injustice anywhere is a threat to justice everywhere." To which we could add the words of our extraordinary founding father, Madiba Nelson Mandela. For to be free is not merely to cast off one's chains, but to live in a way that respects and enhances the freedom of others. When we deny people access to health care on the basis of their class, ethnicity, sexuality, race, or political allegiance, we're in fact denying our own humanity. Conversely, the manner in which we uphold the dignity of others is a measure of our humanity. It exposes who we really are, the essence of our being. I know that with Chris in the chair, the Desmond M Tutu Professorship in Public Health and Human Rights is in exceptional hands. The struggle for human rights is in good hands. Thank you. God bless you.
Well, good morning, everyone. And I sometimes just speak from the heart, but I thought that I might be a little bit overcome after Father's comments. Yes, I am. So I'm very glad that I did prepare some remarks. And of course, becoming the inaugural Desmond Tutu Professor in Public Health and Human Rights is really one of the signal honors of my life. And it means so much to have each and every one of you here to participate in this. And particularly, of course, Father, his wife Leah, his beloved daughters who are both here, Mpho and Tandi, Tunzi. We really greatly appreciate your presence, gracing us. Thank you so much. First and foremost, of course, I need to thank the Arch, but I'm going to do that in just a moment, and thank a few other people first. And of course, that has to begin with Ed and Kathy. So their generosity really in establishing this, I have to say, is matched by something even more precious, which is their real engagement in these issues. And I think that really since our time together in Thailand, we've been in a steady conversation about social justice, public health, human rights, and that has really deepened the work of our center, and I am really grateful. The Tibetans have a saying, I'm a Tibetan Buddhist, some of you know, that people who quietly do good in the world for others have what's called the good heart. Kathy Ludwig has the good heart, and she has really graciously really graciously served as our chair of our advisory committee. The kind of work that we do and have done in conflict settings with gay and lesbian communities in Africa and in Asia, with ethnic minorities facing persecution, is not easy work to do, and it's politically tough. We know that. And so it really is rare to have an institution that is willing to support those kinds of activities. And that's what makes Mike Klag such an extraordinary dean and such an extraordinary leader. And so his team, graced by Barb Verrier, who's been our regular person for our center in the development office supporting us, really done a tremendous job here. Lauren, you are the Energizer Bunny of this effort, and I really am deeply grateful for your support and work over the years. None of us work in isolation, of course. All of this work is collaborative, and our center faculty, students, staff are really our critical core. And I'm just so personally gratified that people with the talent and passion for this work, which Steph Barral exemplifies, the head of our Key Populations program, that they continue to find in the center their professional and intellectual homes. And long may that continue. And we have another center faculty here, Cherie Schwartz and her wife. It's so great to have you here. I also want to acknowledge, of course, our partners and collaborators internationally and at Hopkins. Most of the work that we do is teamwork that requires collaborations with U.S. investigators, with people at Hopkins internationally. There's no better example than Linda Gale Becker. And her extraordinary team at the Desmond Tutu HIV Research Foundation. Linda Gale, as many of you know, is going to succeed me as the next president of the International AIDS Society. So, Father, I'm delighted. Delighted to say that means your involvement in this movement in HIV/AIDS is going to continue in a wonderful, vigorous way. And of course, our executive director of the International AIDS Society, Owen Ryan, is here. And Owen, I just have to thank you personally for all of your incredible support for me in this role. It really has meant a great deal. And then some wonderful research colleagues, Dick Chason, who directs our Center for AIDS Research at Hopkins, and my longtime collaborator, Patrick Sullivan from Emory. You know, it's people, colleagues who become friends, who do this deep work together that actually make our jobs doable. In addition to rewarding. And so deep, deep thanks. And then there's my family. My husband, Mike, couldn't be here today. He's going to come for the AIDS conference, and so he's going to thank you in person. Father has agreed to open the International AIDS Conference, and that is going to be a very special event for everyone. We promised to introduce him to Charlize Theron. But I'm delighted to say that my sister, Dr. Kate Beyrer, is here. I think San Francisco is the furthest distance to travel, so you get and of course, a family member who also couldn't be here, but a family member of choice, our beloved Michelle Bohanna. She is the person who introduced me to Father many years ago. She's the director of the Institute for Asian Democracy, and we know each other from Tibet. And actually, Dick and I have a long Tibetan connection as well. And then there's the arch. So what does it mean, or what could it mean to bear his good name? As you can imagine, since we started this concept, I've spent a lot of time thinking about this. And should we call it a charge? It also feels a bit of a burden. And because of the many attributes that this holy man embodies, one certainly has been his uncompromising stand for justice. Truly uncompromising. And he has been the most resolute of voices for those facing human rights abuses, and held any and all accountable for those wrongs. He's been unwavering in his nonviolent resistance to the evil that was apartheid, in the great human undertaking that was the Truth and Reconciliation Commission, which is absolutely one of the great contributions to humanity that he has made, in the struggle for the rights of women in his church to full ordination, and to the rights of women in the world, and of course to his deity, who I guess we're going to have to now start calling she. But for that integrity and for that uncompromising attention to human rights, we are all in debt, and I am thoroughly intimidated, it must be said. So in addition to bearing his resounding name, this professorship is in public health and human rights. And so I think we also should think a little bit about what that means. What are we attempting to do when we try and bring these great strands of human engagement together? So human rights, from the time of Ashoka, the Buddhist emperor of India, whose edicts are, we think, the first articulation of the rights of citizens as opposed to rulers, have always been aspirational. They are an aspirational hope for us all. And they are universal. They are meant for all, and they're meant to be protected for all. But public health, of course, is a body of sciences. It is a population-based discipline that's been called compassion at a distance. And that's because we're focused not only on the precious individual life, but also on the health of the community, the health of populations. But it seems to me that if we think about the cores of these two disciplines, the basis of human rights and public health is our shared humanity, and the dignity that every individual bears as a basis of that shared humanity. Now, Father has called this Ubuntu, the connectedness of us all, the fact that our humanity depends on the humanity of others, and our dignity depends on upholding the dignity of others. In Tibetan Buddhism, we call it compassion. But I think in the heart of every epidemiologist, every lab scientist toiling away on malaria or cancer or TB, there is that same altruistic impulse. We do the work that we do because we want to make a difference, because we want to reduce unnecessary human suffering, and because we want to save precious human lives. When we bring public health, when we bring human rights into the public health domain, we bring a focus on health and well-being of the excluded. And we do that because everyone is deserving of our compassion, but everyone also has the right to benefit from the fruits of science. And when we've tried to bring population-based methods into the human rights area, we've done that to try and add rigor, to build documentation, to expand the toolkit, and to really start to make these connections between civil conflict in Myanmar, for example, and safe motherhood, between homophobia and HIV risks in Africa, which Steph and his team have been doing so much of, between cholera and misrule in Zimbabwe. And to work on interventions that are going to help, we hope, to improve both human rights and public health. So it's not easy work, and for that reason, I think two things are really essential and that really bring this professorship together. The first is inspiration, and Father, you provide that in such a magnificent way. And the second is community, and that is really all the rest of us, and our interconnectedness, and our upholding of dignity for all. So what do we hope to do with the Tutu Professorship resources? I won't get into this in too much detail, but just to say that we've always focused in the center on research, teaching, and advocacy. That is going to continue. We're going to do that. But the beauty of having these additional resources is also that we can do work where other donors will not go. in contexts where it's very difficult to begin to engage. We're going to use these Tutu Professorship resources to do that. And we're also going to be supporting scholars, and I'm happy to say that we've identified already the first scholar, and she is a young South African woman physician who is at Johns Hopkins right now in preventive medicine residency, and she's going to come out and be the first Tutu scholar. You're all, I hope, going to meet her. She's going to work with Steph Baral and the group with gay men and sex workers in Port Elizabeth. Her name is Cassia Wells. And so I thought it was only appropriate that we announce the first Tutu scholar has been named, and she's coming. So let me end just by saying that there really is no greater joy than having you with us and having you be here personally, Father. It means so, so much to myself and to all of us. He gave us a scare last year. But as a lady running an orphanage in Masipumalele that Linda Gale introduced us to 10 years ago on that first trip, she was talking about how, Father's blessing and his engagement allowed for the building to be built and food for these kids and HIV treatment and care. And I said, it was so moving, as it always is. And she looked me right in the eyes and she said, "May he live forever."
What a privilege to be in this room, in the midst of this company, with the love and compassion and concern for the world that multiplies and re-multiplies. And I hope that each of you walks out of here with a renewed seed of inspiration to take into the oh so vital work that you do in the world. And although this day has been about this chair and these people, everything that has been said has reiterated that this chair and these people and the work that they do and the good that they bring into the world would be impossible without you. And so thank you, each and all of you, for being here, for the journeys that brought you here. And thank you for the onward journeys that you will take that will touch and change lives in ways we cannot yet imagine. And a special thank you in sending you on your way. A special thank you for this very activity and again for this very vision that has created this chair in human rights and public health. Chris, we are very grateful to welcome you as our fearless leader and to also welcome you into the extended Desmond and Leah Tutu Legacy Foundation family. And we look forward to our continued work together. Thank you all for attending. I hope those of you, especially the ones who come all the way from San Francisco, get at least a few days to get over the jet lag on the other side. We have ordered up some wonderful weather for you. So please do enjoy it. Enjoy our city. And thank you all for the privilege of being here. And God bless you.